This is the Tech Podcast Network. If it's tech, it's here. You're watching CES 2014 coverage of the Tech Podcast Network. TPN.TV partners include Dropcam.com and their newest cloud-based web cameras. Visit TPN.TV/Dropcam.
I'm trying to read a name here.
Well, how about this? Why don't you introduce yourself and tell us?
I'm
Absolutely.
Jeff.
How are you? Randy Parker. Nice to meet you.
Nice to meet you.
And who are you with?
Thanks for having us. I'm with MDLive.
MDLive.
And MDLive is the nation's largest telehealth provider of services in the U.S.
Oh, okay.
Oh, right on. Very cool. So what kind of? So we cover health
Yes.
on our shows, and
He's
so
one of
tell
the
me-
healthy geeks, or
I'm not healthy, but I've gone paleo. Anyway, so
Exactly.
so what can I do at the MDLive website?
So we're a virtual health system. We have everything that a physical brick and mortar urgent care center would have. We have doctors, pediatricians, specialists, behavioral health, psychiatrists, psychologists. And it all can be done virtually. So you basically log on either through our mobile app or through any device. You connect to, you fill out a medical history. You then connect to a board-certified physician live, 24/7, 365. They'll provide medical advice. They'll provide treatment if appropriate. They can do prescriptions for non-controlled substances and can have all that done in about 11 minutes. The experience is just exceptional. It brings access to people that may not have had it otherwise. You don't have to take any time off from work. And it's available really as a virtual house call.
That's very cool. So what? I have a bunch of questions. Obviously, one, is it HIPAA compliant?
I'll let him ask the questions.
Yeah, absolutely. Everything is secure, HIPAA compliant. The video is peer-to-peer. So there is no server in that would be in the middle of the two
Really
things. It's
interesting.
just directly from the physician or provider to the consumer.
And so, do you have a bunch of physicians on call, or are they monitoring in a center? How does that work? I guess
Yeah.
from your perspective, and then let's talk about the consumer side. Me connecting in, how
Exactly.
How am I?
Yeah, so the physicians are, the beauty is the physicians can be anywhere. They can be at home, they can be working on their break from the emergency department. The physicians that we have in our virtual PPO network, physician network, are on call. So you can select an on-call. The system knows from the global tracking where you're located, and it has to connect you with a physician that's licensed in the state where you are at that
Interesting.
moment.
Okay.
They're all board certified. There's also, we partner with major health systems across the country. So if a referral has to take place or you're in a specific market where there is a connected care partner, then it could be a physician that is part of their network, or it could be part of the MDLive network that's cross-coveraging. The beautiful part is that all of the documentation that takes place, the continuity of care that takes place during the medical history as well as the physician notes, gets passed on securely to the primary care physician. So if there's follow-up that has to take
To my
place,
primary care
to
physician.
your primary care
Really?
physician.
Amazing. So, does my health plan have to participate, or is it something that I can log on and type in my credit card number, and now I have an instant physician?
So anyone can log on to trymdlive.com, whether they have their plan supports it or not, and be able to do a visit. Usually the wait time has been averaging about 9 minutes. We really focus on the training for the physicians to provide an experience. We use Net Promoter Score extensively, and you can do that for $49.95 in all 50 states. We have many health plans in the U.S. that we partner with, that we're fully integrated with, like Cigna, and Humana, and in those cases, it works just like it would if you go to any other physician practice, except you can do it wherever you are.
Interesting. So, now the obvious question, how many people are naysayers that say, oh, I have to lay hands on my patient. I have to be a part of their experience. How do you get over that? I mean, they want to know all my vital signs. They want to know my temperature, all of those things. How do you overcome that?
So we can capture biometric data so we can capture temperature, we can capture lots of things. Everything is now available on a mobile app that can be transmitted through our system to the provider. But 70% of the cases that we see that get treated are for low acuity cases. So they're flu, upper respiratory infection, pink eyes, things that through the health risk assessment, the physician can determine, and they can see you as well. So they can take a full snapshot with the mobile device and again, securely send it for the physician to take a look at it in that basis. So it's a really, the physician side, that's the consumer side.
Right.
The physician side, when we started doing this back in 2006, we did get a lot of pushback.
Sure.
And today, circa kind of like online banking, physicians understand it does not replace the need to go to the office for a physical exam, but in many cases it's much more efficient and they're accepting it. We have over 3 million covered lives on our system right now, and we have over 2,000 physicians that are participating on our network.
And what about the liability concerns? Are there, I would assume that there's some liability involved in this. What has been the reaction from some of the insurers of the physicians groups that say, gosh, this seems like the ability to be fraught with litigation, or you really feel that there isn't really any risk?
I mean, obviously we have some large clients. We have 20% of the Fortune 100, which are self-insured, who are using our services. As far as the liability is concerned, two things. One, everything is encrypted and recorded. Nice. So every video, every keystroke, every audio is recorded. So there is a recording of everything that takes place, which helps in the liability perspective. The second is that we treat low acuity type cases with the most conservative component. And we have full malpractice insurance. So we've been doing it since 2006. We've had no claims to speak of, but the physicians are really conservative and well-trained to refer when it's appropriate. Obviously, there are things that you would never do with telehealth, and as long as the physicians are monitored and reviewed, we have a lot less liability risk than you would in any other practice.
Excellent. Wow.
Well, it looks like you two could talk about it all.
I'm sorry, I love it.
Yeah,
sorry, I'm a geek and a medic.
Yeah, I mean, you have 30 million people in the U.S., accountable care, a shortage of physicians all over the place, and we're just creating another more efficient way for people that need to be seen, and the ones that can be taken care of through a telehealth virtual visit. This is very appropriate and very efficient.
All right. Cool. Well, where can people go for more information?
They can go to MDLive.com. And on the website, or if they want to use it as a consumer because their plan doesn't accept it, they could go to trymdlive.com and they'll be able to use the service and experience how great it is.
This is awesome. I got to tell you, I mean, you answered all my questions. I wasn't trying to grill you, but I think that really, I mean, those are some of the questions that informed consumers should have. They should know this is a viable option. It's not logging onto Google and going, I have a rash. They should really be seeing somebody.
It's a
that
personal
can see them.
encounter with the you know who the doctor is.
That's
you
right.
know their CV.
Nice.
There's a rating of a scorecard. You can see how other consumers had from an experience perspective,
that's awesome.
Where they went to school. It's just it's healthcare of the future available now.
I love it.
Right.
I absolutely love it. I think it's very cool.
Well, thank you very much for your time.
Thank you for having me today.
Thank you very much. I appreciate it.
Thank you.
That was
Great. Thanks.
You bet.
If it wasn't for our sponsors, we wouldn't be doing the CES 2014 action. Dropcam is one of those sponsors. They have great prices available for cameras that you can put anywhere in your house. If I had a Dropcam, I could actually set it up in the living room and see what's going on. With the frigid temperatures that we had last week, I could have checked in on the house, made sure that the power was still going, or made sure that there wasn't any other problems, listened in if I could hear something, and go from there. So check it out. Go over and check out all the Dropcam models. Go over to TPN.TV/Dropcam. TPN.TV/Dropcam. Of course, it'll help our CES 2014 coverage. Thank you very much, Dropcam.